This video reviews mechanisms of hemostasis. First, let's review the components of hemostasis. We'll start with platelets. Platelets are also known as thrombocytes. Platelets are anucleated fragments of megakaryocytes and have a half-life of 8 to 12 days, or about 1 week. The normal level of platelets in the blood is 150 to 400,000 platelets per microliter. Thrombopoietin, released by the kidneys and liver, stimulates proliferation of thrombocytes. The functions of platelets include aggregation, promotion of blood coagulation, and blood vessel repair. Platelets secrete thromboxane A2, adenosine diphosphate, or ADP, and serotonin. Endothelial cells also play a role in hemostasis. Endothelial cells form a single layer lining all blood vessels. Endothelial cells promote blood flow by blocking platelet adhesion, inhibiting coagulation, and breaking up or lysing blood clots. Activated or disrupted endothelial cells can promote clotting. Endothelial cells synthesize von Willebrand factor to promote platelet aggregation. There are a number of clotting factors involved in hemostasis. These factors are named factor 1 to factor 13. When activated, they start the clotting cascade. Clotting factors are mostly synthesized in the liver. Vitamin K is required to make several factors, factors 2, 7, 9, and 10. Let's review the clotting factors. Factor 1A is fibrin. Factor 2A is thrombin. Factor 3 is tissue factor. Factor 4 is calcium. Factor 5 is proacceleratin. Factor 6, well, it turns out later, this was just factor 5 again. Factor 7 is proconvertin. Factor 8 is anti-hemophilic factor. Factor 9, Christmas factor. Factor 10 is known as Stewart-Prower factor. Factor 11 is plasma, thromboplastin, antecedent. Factor 12 is Hageman factor. And finally, factor 13. This is fibrin stabilizing factor. Let's highlight some of the clotting factors that we will go through next. Fibrin is a protein that binds the clot together. Thrombin functions both as a procoagulant and anticoagulant. During blood coagulation, thrombin converts fibrinogen to fibrin. During fibrinolysis or clot dissolution, thrombin plays a role in the production of plasmin. Tissue factor starts the extrinsic clotting pathway through activation of factor 7. Calcium is a cofactor involved in several steps of the clotting pathway. Factor 10 is where the intrinsic and extrinsic clotting pathways converge. Factor 10 converts prothrombin to thrombin, ultimately leading to the production of fibrin. And factor 12 starts the intrinsic clotting pathway, activated by an endothelial break in the blood vessel. There are also endogenous anticoagulants that counteract the clotting process. These anticoagulants include antithrombin 3, which inactivates coagulation factors and neutralizes thrombin. Protein C, which inactivates factors 5 and 7. Protein S, which accelerates actions of protein C. And plasmin, which digests fibrin strands of clot and digests fibrinogen, prothrombin, and factor 12. Let's walk through the 5 steps of hemostasis. The first step is vessel spasm and vasoconstriction. Upon blood vessel injury, the blood vessel vascular smooth muscle contracts. This decreases blood flow from the rupture. Neural reflexes and hormonal factors cause this spasm that lasts less than 1 minute. This is mediated by platelet release of thromboxane A2, a vasoconstrictor. The next step is the formation of the platelet plug. The platelet plug forms due to adhesion, activation, and aggregation of platelets. Von Willebrand factor, released from endothelium, binds to platelet receptors. The platelets adhere to collagen in the blood vessel wall. Von Willebrand factor activates platelets. Platelets then release factors that attract additional platelets, such as ADP and thromboxane A2, leading to more aggregation. Common antiplatelet drugs include Plavix and aspirin. The anticoagulant drugs Plavix and Brilinta inhibit platelet aggregation by inhibiting ADP binding. Aspirin inhibits synthesis of prostaglandins, such as thromboxane A2. The third step is blood coagulation. Blood coagulation is initiated by either the intrinsic or extrinsic pathway. The intrinsic pathway is slow. The process takes 1 to 6 minutes. The intrinsic pathway begins in circulation as blood comes in contact with collagen in the injured vessel wall and is activated by factor 12. The extrinsic pathway is faster, about 15 seconds. The extrinsic pathway is initiated due to exposed tissue or a trauma and is activated by tissue factor or factor 3. Both pathways converge at factor 10, which ultimately leads to activation of thrombin and fibrin. Fibrin holds the clot together. Starting with the intrinsic pathway on the left, you can see that disruption in vessel integrity leads to activation of factor 12. Factor 12 activates factor 11, which in turn activates factor 9. Factor 9 activates factor 10. The extrinsic pathway begins with trauma to the blood vessel or surrounding tissues and the release of tissue factor. Tissue factor activates factor 2, which then activates factor 10. Both pathways converge at factor 10, and thus the terminal steps in both pathways are the same: activation of factor 10 and the conversion of prothrombin to thrombin. Thrombin then converts fibrinogen to fibrin. The function of fibrin is to stabilize the clot or hold the clot together. To recap the blood coagulation step, clotting is initiated by the extrinsic or intrinsic pathway. Both pathways activate factor 10, which converts prothrombin to thrombin. Thrombin converts fibrinogen to fibrin, which binds the clot together. There are a number of anticoagulant drugs that target steps along the blood coagulation pathway. Warfarin, brand name Coumadin, decreases prothrombin and vitamin K dependent clotting factors by reducing factor synthesis in the liver. Heparin promotes inactivation of clotting factors and suppresses fibrin formation. Low molecular weight heparin inhibits factor X activation. Rivaroxaban, brand name Xarelto, inhibits factor Xa and prothrombinase activity. Dabigatran, brand name Pradaxa, inhibits thrombin. The fourth step of hemostasis is clot retraction. Clot retraction begins within 20 to 60 minutes after clot formation. The edges of injury are pulled together with help from the platelets, as they contain actin and myosin. The platelets and fibrin squeeze closer together, which squeezes plasma out of the opening and joining the edges of the broken vessel. The final step of hemostasis is clot dissolution or fibrinolysis, the breakdown of fibrin. Fibrinolysis begins shortly after the clot is formed and is due to activation of plasminogen. Tissue plasminogen activator released from endothelial cells converts plasminogen to plasmin. Plasmin then digests fibrin strands and the clot dissolves. Alteplase, or TPA, is used therapeutically as a clot buster for acute emergent conditions such as ischemic stroke, acute myocardial infarction, and pulmonary embolism. TPA is a highly potent thrombolytic drug. Finally, let's look at clinical assessment of clotting. These assessments will include prothrombin time, or PT, which assesses factors of extrinsic and common clotting pathways. PT tests factors 2, 5, 7, and 10, and fibrinogen. As variation in reagents used will affect prothrombin time values, the International Normalized Ratio, or INR, is used for monitoring therapeutic efficacy of anticoagulant drugs such as warfarin. The INR is calculated as the patient's PT divided by a control PT performed in the laboratory. The partial thromboplastin time, or PTT, assesses factors of the intrinsic pathway. The PTT tests the function of all clotting factors except tissue factor and factor 13.